Our next panel is going to focus on the future and life sciences in the healthcare industry. So without wasting any time, it is my pleasure to introduce your first panelist, Suresh Madan, President and CEO of MyHealthCentre, who has graciously flown in all the way from Toronto. So thank you very much for making the trip here. I'd also like to re-welcome Dr. Dinesh Patel, co-founder of vSpring Capital, now Signal Peak Ventures, and a primary angel investor in at least 20 IT and biotechnology companies. And our very own Kunal Jain, co-founder of PracticeForces and your chairman of Tampa Bay. And once again, my pleasure to reintroduce physician entrepreneur, Dr. Naik. And your moderator this morning, who has told me, so graciously as well, that if I don't butcher her last name, she doesn't care. Or if I did butcher it. Heather Creran, a seasoned healthcare executive who has also made the trip from Atlanta. So welcome. Thank you.
Thank you. And you nailed it. You nailed it. Terrific. Thank you. Good morning. And thank you again to Ramesh and Tampa for having me down from Atlanta, where I'm a charter member. And I think great for us to follow the disruption because as you all know, there is not an industry that's changing faster than healthcare. So we're going to talk a little bit, but the truth is we want this session to be extremely interactive. So we'd like to do a lot of Q&A. So if you haven't come with a question, please start thinking of questions, and we really do want to engage with you. So again, healthcare, changing as fast as it has ever changed, an exciting time. Healthcare used to be the place that time and technology forgot, but that is not the case any longer. And really, it's a revolution happening in every way imaginable. And I love being part of healthcare. I love talking about healthcare because everyone I talk to is a consumer. We're all consumers throughout our entire life, everyone. And yet, we don't pay for it. We oftentimes don't even know, and actually we really don't even know the costs. We also don't know the quality. What kind of care am I getting? I may love my doctor, and apologies to any surgeons in the room, I may hate my surgeon, but do I really know if I'm getting a good quality of care? Because bedside manner is not a predictor of outcomes. So it is. It's a very, very sort of interesting industry. And I just want to frame up, too, with some statistics. In the United States, we spend $3 trillion, with a T, dollars a year on healthcare. It's growing over 5% a year. It's almost 20% of our GDP. We spend $10,000 per year per person on healthcare. The average of other developed countries is 3. So, and the World Health Organization, who ranks countries, we're ranked 37th. We're behind Costa Rica. Canada's actually 30th. Spends about $6,000 per year. And what we also know is that about a third of that, $1 trillion, 33 cents of every dollar we spend is waste, whether it's administrative inefficiency or fraud, abuse, overuse, underuse, errors. So if those statistics don't scream at you that there's disruption and entrepreneurialism needed to help revolutionize healthcare, then I think another would be to tell you, and as you read the news, who's coming into healthcare? Big. Amazon, Google, Apple, IBM, Walmart. And why is that? And I think there's 3 sort of large macro trends. The first is that healthcare is moving from a very highly centralized model where the hospital was the center of the universe to a much more distributed model, where we're going to go to our pharmacy. CVS is not CVS Pharmacy anymore, they're CVS Healthcare. In the home, there's a huge opportunity for home health services. Our phones, I think the most disruptive medical device of the future and present, really, is our phone. So much power there, and we have it with us. We also have the moving from treating populations and one size fits all to personalized medicine. It's getting more and more inexpensive to sequence our gene and understand our genetics for cancer patients to understand the profile of their specific tumor. We know that drugs work differently in my body and your body. We know that foods react differently in each of our bodies. And there are some that will tell you, they can tell what wines your palates are going to prefer by your genes. So lots going on in personalized medicine. And then finally, the big data, the opportunity that big data and analytics and machine learning to not just predict and intervene, to be able to affect and change healthcare and help solve problems before they happen, as well as to optimize treatments and therapies. So now I'm going to be quiet and open it up to our very esteemed panel and start really by asking, and maybe Dr. Patel, since you started, so you've got the juices flowing, what trends and opportunities do you see?
So as you mentioned, personalized medicine, genetics and testing of the gene, that has become the major trend. The one thing that I would like to say, when you say personalized medicine, people assume that drugs are going to be made just for you based on your genetic profile. In essence, it's actually an exclusion criteria, because there are certain drugs that will never work for you because of your genetic makeup. And what they are now doing is excluding you from that. Typically what was happening, if you look at a major clinical trial, it may work on 55% and not on 45%. And yet the drug is approved because the statistic says there's a statistical outcome. Today you can exclude those 45% where it doesn't work. So to me, that's more of an exclusion criteria. And for people who are not too familiar with Utah, we have one of the largest database on genes because of the Mormons, the way they maintain their history. And more disease-causing genes have been discovered in Utah than anywhere in the world. Mm-hmm. So I do a lot in that space, genetic testing and things like that. So anyway, that's where I see a lot of the trends.
Okay. Suresh?
So Paul, greetings from Canada. We Canadians actually love Florida. We consider it as our second home. In fact, if it was possible, we'll declare Tampa as our winter capital for Canada. There are almost 1 million Canadians who have some of the other connections to Florida. So I'm very happy to be here representing Toronto and representing Canada. Also, I'm very happy with I don't know if there are any baseball fans in the group, but we're doing better than Tampa Bay Ray this year, and we're on the playoffs, so we're happy for that as well. Healthcare industry is kind of unique in a sense. We traditionally have had information asymmetry. We have had, which is changing, but we're still not anywhere closer to a more dispersed information symmetry. The industry has a lot of emotional decision making. When we suffer from any ailment, we don't take decisions rationally. We become too emotional about it. So traditionally, the market forces which work for any other industry, IT or anything else, really don't work that very well in the healthcare because of very complicated structure. Involved with that from a provider perspective, as I'm in the healthcare providing business, we are facing certain macroeconomic challenges within our environment. A reimbursement rate cut over last many years, given due to fiscal pressures of high cost and high waste, as Heather articulated. And the high reimbursement rates also has resulted in increasing regulation within our industry. Resultingly, I find in terms of future, there is a huge need for bringing in professionalism, incorporating efficiencies, and that provides an opportunity which has been a trend over a little while now, is an opportunity of consolidation. An opportunity is to perform better to reduce waste, both at the patient level as well as at the provider level and at supplier level. So that's a huge trend, and I'd like to discuss a little bit more about the theme on consolidation within healthcare and how that will improve cost structures, how that will improve the efficiencies in the system.
Kunal? Sure.
Well, I'm watching each and everybody and their faces. I mean, absolutely, this is a phenomenal day today. I think in this year we are completely sold out, and this is the best TiECon. So give yourself a big round of applause. And thank you very much. So yes, my background is in healthcare for the last 15 years. I have set up a revenue cycle management company in Tampa Bay. It's called PracticeForces. I started working on my, so this is how I see my last 15 years. Every 4 years, I have set up 4 companies so far, and in healthcare space. So I started in year 2000. We started working for Henry Ford Hospitals in Troy. That was my first exposure when I came to this country. I was an offshore vendor for them for 3 years in India. Then I moved here in 2003. We started PracticeForces, and we are still running that company for the last 10 years. Then after 3 years, we started another company in India where we launched hybrid outsourcing model. We have about 300 employees in India. They're working for US-based medical healthcare facilities and management companies, and they are doing a back office offshore work. Now I'm sitting on my 4th startup. It's called Eat Well, and the motivation behind it was my meeting with one of the doctors. I don't know if you have heard his name, Dr. Andrew Wells. He's a professor in University of Arizona, and he's a renowned, he's a very, very renowned guy on the sole mission of his life is healing and prevention of disease by eating right. So I see now the healthcare is moving towards more like an integrative approach with consumers and going away from chemicals, what I call like drugs and surgical treatments and all of that. People are going towards more like, I call it an old Indian traditional way of treating or healing bodies, like meditation, yoga, and eating right. So what we are planning to do is like, we are focusing on how we can create recipes and menus based upon the medical conditions or genetic, as you said, the conditions of patients, and then cook that kind of food and deliver it to the homes in a right way, which is like a fresh home food delivery based upon the medical conditions of patients. So I see that the trend is going towards more like an integrative approach where the healthcare is not just based on medicine and surgical treatments, but there are a lot of alternate ways which are coming up, and they're opening up huge opportunities for businesses as well as entrepreneurs who does not come from the medical background. So that's where I see the whole, a lot of medical industry going towards.
Yeah, I've been with healthcare since 1983. I had seen the past of the healthcare. I'm seeing the present as well as I'm going to see the future. I think American healthcare is perhaps not 31st or 35th, it is number 1. If I get a heart attack here, I can guarantee if I were in England, even in Canada, I will survive in America. So this is the best healthcare. Yeah, that is a problem. So despite all the gloom and doom, oh, healthcare is expensive. Yeah, it is expensive, but what good is? What money is going to help? If you are not healthy, what good is going to? You're paralyzed, waiting for a knee replacement for 6 months. In England, people don't even get knee replacement. They think you don't need to walk. So, there are some problems in this healthcare, but I think the innovation is happening in healthcare with help of technology. So, it is changing. Like the mobile banking, I'm very impressed with the mobile bank. It's going to happen. It's going to be a mobile doctor. I will have a doctor in my pocket. So that's going to happen in the next few years. I think the future of healthcare is very bright, innovative people are in this country. And I think if we work together to prevent the disease, which is happening, like he's doing this Eat Well, so maybe I need to, maybe you can give me a try on me, maybe I should lose some weight. So I think healthcare industry is going to do well. Personally, I'm a physician, so I still like to work. I have not been working as a doctor for the last 4 months. I'm getting impatient now to get back into the field because I cannot stay home and do laundry. So, but I think healthcare is, if you really want to invest, please invest in healthcare. Sometime, you may fail, but again, I think it is my good experience, and I have done very well. But again, you need to have a passion about doing what you do. But about the future of the healthcare, I think we are doing very well. You can cure some disease. Like hepatitis C drug costs $100,000, but if you have hepatitis C, don't you think it should get cured? Yeah, it costs money, but everything costs money. Thank you.
Absolutely. Terrific. And great segue, because you said invest in healthcare. So the next question to the panel, who comes at this from a number of different ways, is now as folks have ideas and they start to execute on them, what are the hot areas of investment in healthcare from an investor perspective, and any specifics about the Florida companies that are here in Florida? Okay.
So, of course, I see so many healthcare apps and ERMs and all these things. EMRs, I'm sorry. You see so many of these things. At some point, you give up investing because just you don't know, there are just too many. I think as an investor or as somebody looking at businesses, the key is reimbursement. That has become a major issue now. If you are developing a new drug, or even if you have an application, who is going to pay? Now, my first rule, and apologies to Dr. Naik and other physicians, if the business model is the doctor is going to pay, I said, go home. The doctor is not going to pay. They are under pressure, they're not going to pay. But if your insurance company is paying, I like that business, or if the hospital is paying. So I'm looking mostly for deals where it's making it efficient, but there is reimbursement, clear path to reimbursement. And again, lots and lots of people developing systems for the physicians to improve their offices. Well, individual practices are shrinking. It's becoming consolidated there. So again, the focus is more on hospitals and the peers. That's my number one kind of area where I look at in this space.
No, and that's huge, because so many people coming in from the outside don't understand how convoluted the paying system is, and your customers often are not your payers. So, great point.
I'll pick on Dr. Naik's theme on investors, and I see a lot of opportunity to get into healthcare in the bread and butter business of healthcare, which is providing healthcare services. The industry, due to all the macroeconomic pressures of reimbursement, of regulation and others, and also with the Obamacare changes, is undergoing a need for a better, efficient healthcare service delivery. And that better healthcare service delivery comes with scale, comes with professional management, comes with understanding your costs and managing them in a better manner. And and this is happening not in US alone or not in Florida alone, it's happening all across. It's happening in Canada as well. In Canada, we treat healthcare delivery is a little bit different. Some people call it a socialized model, which is actually not true. Even though in Canada we treat healthcare more as a human right and not so much as a business opportunity. And when I say human right, every resident is provided a healthcare service, irrespective of whether he has a job or not, whether he is older or younger. Everybody has a right to obtain healthcare. And resultingly, many of the healthcare issues are treated well before they become very severe. We do have issues, we do have long wait lines, we do have problems. It's not that system is without any issues, but as a healthcare service provider, We are also facing reimbursement rate cuts, and therefore there are opportunities of providing efficient and better services, which requires entrepreneurship, which requires management, and which requires understanding a model to achieve better, reduce your cost, and achieve the results through scale.
Yeah, I think about investment in companies. So if I want to invest, I like to invest in companies which are data analysis or call it data informatics. The things are like a patient. Suppose you had 100 patients with diabetes. I want to know how many are controlled and how many are not controlled. And those, somebody just puts a button, out of 100 people, 10 people are not controlled, so I want to call all 10 people and see them every week, every month, and improve their health. So technology companies which can do that will be very successful. So the data informatics, healthcare, we are still running behind. See, I've been booking airline tickets online for many years. But again, how can you book, there's a few companies that are doing now, you can book doctor's appointment, say, hey, I want to see Dr. Naik at 10:30 on Tuesday. You can do it now, but why it took so many years to do that, right? So you can transfer the money from one bank account to another. So, but in healthcare, we are far behind in technology, so I'm really surprised that in next 10 years, there'll be so many technology companies will be focusing on healthcare. I think Google is one of the companies which is going to invest in a lot. And cost containment is very important, but cost containment can only happen if you are efficient. So if you are more efficient, the cost containment will automatically come. There is always a fraud, but not all doctors are fraud. So maybe 99% are very honest. There's always some people who do some here and there, but I think with healthcare merging with technology will improve, and those companies who improve the efficiency of the system, cost containment will do very well, and I would like to invest in those companies.
So they are investors. I would like to give my perspective because I'm not a major investors like them, but there are two things here. One point which I would take, this is absolutely necessary, who is going to pay for your health care? And it's an easy path. Insurance company pays, Medicare pays, boom. I mean, no doubt about it, people are going to invest with you. Nowadays, the trend is more, as I said, integrated approach. Even if consumers are paying for it or not. I see a lot of solutions coming in the market where people are doing cash bargaining. If you want to see the doctor, okay, pay $50 cash flat fees, go and see the doctor. If you want to have a surgery, there is a bidding portal. You go on the portal and ask for the bidding, and there would be 3 hospitals bidding for the orthopedic knee surgery or some kind of treatment. So there are, I mean, consumer is coming up very well with the high deductible prices, and the insurance company is getting tighter and tighter every day. So the consumer is becoming a king, and it's controlling healthcare in a big time now. Another trend, to answer your question about the challenges, why it took so many years to book an appointment with the doctor now online. Well, healthcare, there are a lot of pieces, like your hospital is involved, physician office is involved, patients are involved. So you are not solving just one person's problem. You are integrating those 3, 4 different segments in one chain if you want to create a system. So just to give you an example, in order to create an appointment online with the doctor's office, you need access of their EMR, which a software company provides. You need access of the hospital system, which is controlled by a different, different company altogether. And then you need a good understanding from the doctor's office to allow and to work, to use that workflow in a coordinated way and in a tight integrated way so that data doesn't get lost and every system works with each other's system. So, and that area is still a very gray area. I mean, people are not able to successfully communicate and coordinate amongst each other. It's still like we have been talking about HL7 for the last 10 years. I still see hospitals, they are still working on old Unix-based systems, So some of those technological challenges still stands, and that becomes a bottleneck where, the technology is slow when it comes to the healthcare. But I think now it's the right time, and people are very positive about it, and it's coming at a faster pace.
Exactly, and I think we're starting to think about patients not as patients, but
Right.
as customers.
As consumers,
right?
absolutely.
And
So this
consumers
is
and making
opening up,
choices,
absolutely.
and you used to be an insurance, insurance
Correct.
company was
So like,
paying for you, but
yes.
now you're engaged.
You are engaged. So
Different-
that's,
different
I think that's a very positive trend.
Good, good.
So,
Oh, go ahead.
Just one comment on cost containment, improving the medical devices and all, those are also a big area of innovation. And just like to plug one of my companies, people who are doing laparoscopic surgeries, the system itself today costs anywhere from $300,000 to $500,000, depending on all the bells and whistles that you buy. Our system is going to be a cell phone, that size. That's it. And it's going to cost, it's going to cost less than $20,000. And the quality of the picture and everything is much improved because we're taking existing technology. The cameras are there. You're just integrating, what we call mashup, right? You take the best from different areas, put it together. And so now a small hospital, a rural hospital, can afford a laparoscopic. They can do the surgeries because it doesn't cost that much. But that's the kind of innovation is going to be needed in order to comply with the efficient markets that are needed today.
I don't know if anybody has heard about a health kiosk. Has anybody seen health kiosk? There is a health kiosk in Tampa Bay. I think there is one in Clearwater. There is a company from Miami. They launched health kiosk where you don't need a doctor. It's like an ATM machine. You just go into it, close the doors, and it guides you everything. They have a video camera over there where you can see the doctor, and he guides you. Okay, here you take your blood pressure, here you do this, here. So you can do your first visit with the doctor absolutely without doctor in that health kiosk. And it's cash. It just, you go, they charge you credit card, $70, $100 as per your visit, and then you're done in 15 minutes. No waiting, nothing, and it's being set up in the malls. So when you're free, whenever you have time, you see that just like an ATM machine and go in and get your checkup done and come out.
Amazing.
Yeah.
Convenience, it's all
Yeah,
about
it is, and it's
convenience,
a
right?
Florida company who is doing this, who has launched this.
Great.
So this is the
Yeah, only disadvantage with this is 2 o'clock in the morning when you get chest pain, the machine is not going to talk to you.
No.
Yeah, but I think that's a good thing, yeah, right. Sometimes we do health fair for poor people, you find out a lot of things. People don't go to a doctor. That's problem. So I think that concept is good. If you can't go to sleep, just go to health kiosks and get your blood pressure checked, and nothing wrong in that. You can prevent some disease, but I think you still need a good doctor.
Yeah, absolutely.
But as your wife is racing you to the hospital, you can have doing an EKG and sending it to the ER doctor so they know what's going on even before you get there.
There is clearly a trend towards patient empowerment, and as Kunal said, patients as consumers rather than patients. Historically, one of the reasons for slow adoption of technology in this sector has been concentrated decision-making role, where patients did not even have any of their health information with themselves. All health information resided with doctor's office, and patient did not know much about that, and all the decision-making resided. And physicians are very busy professionals, and as a very busy professional, and they know, and they're very well educated, and they have the expertise, they also have resistance to change their own workflow. And that resulted in a resistance in change on adoption of newer technologies to some extent. But as we are going more into a distributed decision-making and patient empowerment, this is going to be impacted, and this is going to be changing. Add to it the issue of chronic diseases. We are living longer. Almost half of the adults have struggling with one or the other chronic disease. Some of them are struggling with more than one. Almost 20 years of our life we have these diseases, and resultingly, these patients want to be aware. They want to be empowered, and therefore the market is ready for various types of technologies which will empower them, no doubt.
Terrific, terrific. Okay, we have about 15 minutes left. Would like to open up to questions.
Hi, Tracy Ingram. So on the resistance to change and really looking at disruption in hospitals and medical situations, from what I've seen, a lot of times when the new disruptive medical device, the new disruptive medical technique comes out, it's left up to the physician or the practitioner to be the decision maker. And so they have to, a lot of times they're very busy and they're absorbing a lot of the risk. So now they're taking it on and they're maybe not getting the reimbursement. So it puts them in a challenging spot and it becomes really that hurdle for adoption. So what are maybe some ways or some of the things that you've seen that help physicians ease transition and not be roadblocks in some of those mass scale adoptions?
You know, I am privileged to be working with a number of physicians in my practice area, cardiologists, radiologists, gastroenterologists, even primary care physicians. The engagement of the physicians, working with them, and making them aware of what's happening out there in terms of technology, and over time you do get a buy-in. The method to engage with them and work with them and inform them and work as much as possible is, I think the physicians are going to continue to play an important role. The sector will continue to have information asymmetry. Resultingly, we need to get a buy-in from them. And hopefully, and it is happening. People are becoming more and more aware. And some of the media engagement of Google and others coming into healthcare is also making physicians more open to technological innovations, so which is useful for sure.
I think what you are finding also is, again, reimbursement, right? The hospital gets paid certain amount, and a lot of doctors are now saying, hey, is it me that's deciding or is it the administrator? And the administrators are forcing some of these issues.
And I was also going to say, as you're doing trials on your device, bringing it up through, because obviously you just don't walk into a hospital and start selling a device, but having key opinion leaders involved in that process as part of your advisory board doing those studies also helps once you have something to help drive that adoption. Yes, Chuck?
So I have a kind of a selfish question. Working with this new company, it's in order to change a system, I believe in go big or go home, right? So you want to change a system, do a 10x change. That means you have to change the system. So trying to change the way the system works requires somebody to find a point of control. So this is a quote from an administrator from 2 weeks ago. After I explained what we do and how there's a $30 billion waste in one particular area, she looked at me and said, you know, Chuck, I feel like I'm the guy with a bow and arrow fighting everybody, and you're standing behind me with a machine gun, but I don't have a way to turn over and pick it up. So because of that, investors are looking at companies, the one that I'm working on now, they're saying, yeah, you're right, but I don't understand it. The administrator doesn't figure out how to make it. The system is too complicated, so I can't find a single point to connect it to. So how do you deal with that? How do you get those companies that are really going to do a 10x improvement get funded?
Well, that's so adoption, and you know, if you go to a large hospital system, let's say SAP or one of these big systems in there, to get them out is so difficult. I mean, that's the big issue, right? Even when you're dealing with the pharma companies, it takes years to get in, but once you're in, they can't kick you out. Same thing with the hospitals, right? They have spent so much money, so much time, that it takes a lot of time to get a change. So some of the newer mergers and acquisitions, the bigger changes are happening, that's when you have an opportunity, because let's say hospital A has system 1 and B has system 2, they have to do something anyway. That's your opportunity. Because you try to change the system they've been using for years will take a very long time. But again, lots of mergers happening, lots of integration happening, that's the opportunity.
Over the last 4 to 6 years, we've seen a nationalization of the insurance company, healthcare insurance, and certainly it's had an impact on the delivery systems. And I'm wondering what your position is on the role of government in delivering health care.
Loaded
Yeah,
question.
I think,
Let's
yeah, that's
go.
good. Yeah. So the answer is very simple. If you want government, go to my friend on the left. He's from Canada. And you can choose to have a heart attack in Canada or here, Tampa. Or you can get knee replacement here or never get anywhere in Canada. Nothing wrong with Canada. They all get good care. But I think government is realizing that few years ago that I've been doing it for a long time, called Medicare Advantage Plan. So Medicare is government-run program. So Medicare is not run efficiently. Everybody knows about it. So they decided to give to private companies, like my friend Dr. K. Patel started a company called WellCare, sold for millions of dollars, and retired for 1 year and 2-3 years, and he came back again. He started a new company. So that's why the government should not do it. They should allow the private people, innovators, thinkers to do that. Government can never think correctly. That's my experience. Right. Right. Well, no, there are prime examples. Nothing wrong. The healthcare is very personal, but I think the government is perhaps should be out of healthcare completely and give it to private company. That's all my opinion. I don't know because I deal with Medicare, Medicaid every time. Even in Florida, Medicaid was run so poorly, they gave all Medicaid poor patient to private insurance company. At least when I was practicing, I'm still practicing, I was practicing here, there is not a single orthopedic surgeon in Tampa area who will see a Medicaid patient. So we have to send it. One doctor in Lakeland would see the patient. But now Medicaid gave this business to private companies. Now they're able to find some orthopedics, not a lot, but at least they don't have to go to Lakeland. So that's the difference between private companies versus government.
Thank you, Dr. Naik. I fully realize that I am in Florida. But I would still say, I would definitely like to highlight the pros and cons of the system we use there. So in Canada, we have healthcare delivery is done through private methods. So we have practices, we have private hospitals, we have and supply of equipment, IT, devices, all of that is private. One thing which is public is the payer system. So everybody, just imagine, is covered through Medicare. So we don't have, even though we have supplemental private insurance for add-on things, but which covers about 30% of our medical cost and 70% is covered through public funds. The advantage is everybody is covered. So when it may take a little bit longer time in heart surgery. I recognize that, and that has been said. But if you want an appointment for routine things, a primary care physician, a mental health appointment, or appointment which really do not make a lot of money for providers and do not involve a lot of different types of testing, you are better off in Canada because these appointments are much quicker. They are handled promptly. The appointments which are, if you want a breast implant, better go to US rather than staying in Canada. If you want a open heart surgery, US is a place. There are so many things where we can do better, which are probably 80% of medical needs, but some high profit and procedures, our wait list is just too long. The system there wants you to go through an X-ray before you can even be, any MRI can be ordered, while in US, we know that the number of MRIs are actually about 3 times more than what are medically required. So the system there allows for lower cost, and that's probably one reason the cost of healthcare in Canada is about 60%, as Heather pointed out, to what it is in US, even though we have 100% of the population covered. 100% of the population have medical treatment, but cost is only 60%. And our cost per employee or cost per physician are not very different. In fact, today the physicians in Canada make more money on an average than physicians in US make. And that's the fact.
Yeah.
Hi, my name's Nirmal. I'm a practicing plastic surgeon in South Florida and an investor. And I do have to say that you're right, Suresh, that the doctors in Canada do now make more than the doctors in the US. I have a lot of friends there. But I wanted to, I've heard a lot of buzzwords: interoperability, decentralization, consolidation, and I'm associated with a company that's involved in the healthcare IT space, and I wanted to talk about barriers of change, because we heard some stuff about people meeting with administration and why aren't physicians using all of these new technologies. And I think from my personal perspective, none of those technologies has really made my life easier as a surgeon. I am mobile, I'm on the go, and that's what my company works on. And when you look at Epic, when you look at Cerner, when you look at Practice Fusion, I've used them all. None of them made my life easier. There's, talk about data silos, and there's data vomited all over a page, but it's not meaningful for me. You can collect all the data you want, but if you don't have the people who know how to use it, or the people or the infrastructure in place to use it, I think it's meaningless. And I have to agree with Dr. Naik, what he said about, I don't think the government's going to be leading this charge. When you look at meaningful use, I have friends of mine where Medicare is contacting them 5 years later, saying, you owe me $18,000, you owe me $20,000 because you didn't take a snapshot of your computer screen showing that you completed one security check 5 years ago. So I think patients are going to be, part of the revolution, like you mentioned, Kunal. But I also wanted to hear what your thoughts were about the existing IT systems that are out there, so.
Well, IT, as I mentioned too, integration is very important. Talking with each other system, that is going to be the key. So with the new exchange program government is coming with, like every state will have their own health exchange. It's going to benefit a lot, and it will open up a lot of opportunities for EMR companies, as well as patients and the doctors. I have seen like doctors now sending, a PCP is sending his referrals, his authorizations, his patient documents electronically to other doctor. It used to go by paper earlier. I mean, there were days like you used to mail it even, or you used to fax it, but now it is going like one click, you can send it to. So I saw up to last year, like they were specific to certain EMR. Now this year the change has occurred. So now it is across the EMRs, like 2 different EMRs, 3 different EMRs, you can talk to each other. So it's coming, technology is coming. It's just that, as I said, the ideas were there even 5 years ago or 10 years ago. But with the healthcare, laws are so strict, especially with the privacy law, that you cannot divulge patient information publicly, or you cannot take a risk of divulging the patient information. And because, as you said, you never know. You get a attorney's notice and lawsuit from the patient. You get a lawsuit from different parties. So that fear factor is driving. That fear factor is becoming a bottleneck. But at the same time, with a growing integration, and the government is pushing the change and opening the channels, and software companies are opening their doors for the integration, it's going to open up a lot of opportunities.
And I think it's a great example of what happens when products are designed without thinking about their end users in mind.
Yes.
Right? Because the government, and I think there's not a person that doesn't agree that data needs to be available and accessible. So the government said, we're going to do it by this day. Right? And now you have all these big companies that come into this space. EMRs are everywhere. There's hundreds of different systems. The doctors weren't involved. But now you have a situation where you've had hospitals that spend billions with a B to put Epic in, right? And it's going to be a while before that changes.
Let me ask a poll. How many PCPs, is there any primary care physicians here? So if you see your file rack in your office, and you have 10,000 patients, 10,000 files, do you see that 80% of that data which is sitting there just because there is a law you cannot shred that in 7 years, do you ever see that data again? Like how many times? So that whole thing, I have a client who just replaced his 2 rooms, which was full of files and racks and papers, and they just scanned all of that, digitized it, and they created exam rooms. So they opened up opportunity, and it was just because of they were not using the technology efficiently, but now doctor decided to use it, and he made immediate change. So these are the changes which are coming up. It's just that somebody should be able to acknowledge it, use it, and adopt it. That's the point I wanted to make.
I think healthcare IT has changed because I've been seeing when my office girl will used to fax a prescription to the pharmacy, half the time the fax doesn't reach. But now click a button, I'm doing more work now. I'm sending the prescription, faxing everything myself. The new thing called P2P, suppose I want to send to Dr. Nirmal on patient plastic surgery. I just, with a click of button, I can send my notes, not only my notes, my labs, my last few notes. So so that's why the technology is going to eventually cut down the cost. Because suppose I send a patient with diabetes, he doesn't even know the patient has diabetes. Well, but I send all the notes electronically. It's like sending an email. Instantly he gets it. We are still learning this. Doctors are very slow. As he correctly pointed, we are slow learning. But I think with the new generation, I think they're learning fast. So we'll be there.
Anybody has a question?
I was going to say, I think we're out of time.
Yes.
And so what I would suggest, though, is we're all going to be here all day.
Yes,
so maybe
please talk to us
we can get some time to discuss, because I know there were a lot of questions. Thank you. So, good. So thank you very much.
Thank you so much.